One of the biggest lessons we've learned after running over 6,000 labs is that nearly everyone has a problem with their hormones. And so, what is the reason behind that? The research is actually pretty clear. Decade after decade, we're seeing a decline in total testosterone, we're seeing estrogen disruption, and we're seeing progesterone issues. One of the issues is we're being exposed to all these chemicals and a lot of microplastics. It actually looks like microplastics may be one of the biggest issues, but they're in our environment. So what do we need to do? Well, the first thing is you want to make sure that your gut is really healthy. You want to make sure you're not having any issues with gastric distress, gastric bloating. Make sure you're getting plenty of fiber. Those are the natural interventions, and possibly even probiotic and fermented foods. The other thing you want to do is make sure just overall you're minimizing the toxic load on your body. Eat clean foods, stay in clean environments. These are all really key things. Try to limit the amount of chemicals that you're putting on your body or in your body as much as possible. You can have plants around your house that help really clean the air. You can have the air purifiers, but other than that, try to minimize eating out of plastics that you're warming up, because anything that you heat in plastic or any acidic foods or drinks in plastic is more likely to cause more availability for plastics to leach into your body, so minimizing that load. And the last thing is more on a clinical aspect. What can you do to optimize your hormones? Well, if we're talking about thyroid, you need to look at those thyroid markers to really understand, what levers do you need to pull to optimize that. And when it comes to steroid or sex hormones, those really need to be looked at as well, because there's all these mechanisms and all these pathways and enzymes that are upregulated or downregulated depending on what's going on. But what we have found is after a period of time where you're looking at fertility or having a child or children, if that's in the books for you, beyond that time, you almost are going to need to do some type of hormone optimization. And that's one of the reasons we've become so passionate about hormone replacement therapy. So if you're interested in that, you can click on the link in our bio, find more out about what we do for hormone replacement therapy. But at least you can start with the interventions that I mentioned. Hope that helps.